Britton. Welcome to the FitMind podcast.
Thanks for having me.
So I think the work you're doing is very important, especially at a time when meditation is reaching a ton of people. And as you put it, it's often pitched as kind of a warm bath, this, cozy thing that you do for a couple of minutes a day and it'll make you feel a little bit better. But there's obviously, as you get into practice and start peeling away the layers, and you realize that it's maybe not just about calming down for a couple of seconds, and especially in the more deep end practices that you might find if you go on a meditation retreat, you start to get into some sticky psychological territory. So I'm excited to explore some of the potential pitfalls that someone might encounter on their meditation path. But first, just curious how you got into this to begin with in studying this.
In meditation in general?
Or in studying meditation as a scientist, yeah.
I mean, I think I got into it in a very similar way to most people, which is that I had like a life crisis. A friend of mine committed suicide when I was in college, and I developed a kind of, quasi anxiety disorder and thought I was too young to start on medication. And my dad sent me A Path with Heart, which is a book by Jack Kornfield, and that was my gateway drug. I started with that and got really into it. And by the time I was in graduate school, I did my dissertation on looking how meditation impacted sleep, and did one of the first studies on biologically recorded sleep, so brainwave based sleep, and basically found the exact opposite of what I hypothesized. So I thought that, meditation's relaxing, it should make you sleep better. Maybe that's how it improves depression. And we actually found that it didn't make people sleep better at all. They thought they slept better, but their brains were actually much more activated. So I think that was maybe the first step towards where I am now, which is our assumptions coming from a kind of health orientation or psychological treatment orientation towards meditation are often wrong. And when I talk to a meditation teacher about it, and so, I mean, the confession there is that I didn't publish that data for like 5 years because I thought it was I didn't have the right answer. I shouldn't publish it. It was,
you thought it was a no finding?
Yeah, I thought it was a null finding, and it wasn't really contributing to like promoting meditation as a treatment. So I just sort of buried it for a while. And then I was talking about the results on a retreat like many years later. And the teacher on the retreat was like, she's like, everyone knows that meditation, like if you do it enough, like makes you stop sleeping. So I don't know what's wrong with you psychologists. You're always trying to make it into this like relaxation technique. And so, so I did publish the data, and I started asking meditation teachers more about, well, what else should I know about? And what other little stories are you hiding? So that was the beginning of the Varieties of Contemplative Experience study, where we just simply went to meditation teachers, often ones that had been running meditation centers and retreat centers for decades, and just simply asked them, like, what have you seen? And, specifically, what kinds of challenging states have you seen? And, what do you do about them? Because I think that, we already have so much, research on the benefits and the health benefits. It's like overwhelmingly, that's what the research is about. But nobody's really asked any questions about the more challenging states, or just simply states that don't fit the criteria of health benefits. They're just weird things that happen, which are very well documented in the Buddhist texts, but in terms of modern scientific research, almost entirely untouched. So that was 2007, and it took us 10 years to ask that question and analyze 3,000 pages of interviews, but we finally published it in 2017. So that was, and we're still going. There's lots more on that particular study.
Yeah, well, that's so essential as these practices kind of make their way from the East and are taken out of their traditional, often religious context and put in a secular context. I hope that you don't share those results with the Calm meditation app, because they're certainly saying a lot about their ability to induce sleep. Although maybe that's just their bedtime stories. Like if Matthew McConaughey is reading to you, you might sleep better. But I think what you're talking about is often the more, well, correct me if I'm wrong here, but I'm curious, what are we talking about, the 10 minutes a day meditators, or are you more focused on the meditators who are really doing hours at a time and maybe they're on retreat? Is there a difference between those groups and what you're finding?
So our knowledge about this topic is trickling in from different sources, and with any research, the way you design the research and pick your sample and the questions you ask kind of determine what kind of conclusions you can make. So with that particular study, this is called the Varieties of Contemplative Experience study. We deliberately started with meditation retreat centers. And so a lot of the people that we ended up with were people that the teachers that we interviewed told us about who were on retreat. So that was, it was already a biased sample. But even within that study, about 25% of the meditators who were reporting various kinds of problems or challenging experiences, they were not on retreat and they were meditating less than an hour a day. So even in that study, we did see some evidence that it did not require intensive retreat time. Since then, I run a organization called Cheetah House, which is a nonprofit that supports meditators in distress. And we have had hundreds and hundreds of people call and ask for support. So now we have another sort of non-research sample, but we have a sense of, what other types of conditions can produce problems. And we're actually seeing quite a few app users. So I make a policy of not mentioning specific apps by name, but we'll just say that, some of the most popular ones are definitely showing up at Cheetah House. So I think that, the perfect storm between, specific kinds of motivations, personality, physiological constitution, and practice, and depending on the app and other conditions, how much supervision they're getting, or corrective feedback, or tailored meditation instruction, all of that can combine to create problems.
Right. And so what are these people reporting? And also, how do they know that it's a direct result of the meditation as opposed to just psychological issues that they're now recognizing as they happen to start meditating?
So the issue of causality, which is the second question you asked, is a very complicated one. And there's an extremely long explanation of how we assess and establish that meditation is in fact the cause. But I'll just say that there are basically 13 different criteria that are used by federal and international government organizations like the World Health Organization, the FDA, NIH, that they use to establish causality in the absence of base rates. So these are things like, it had to happen during or immediately following meditation. It had to go away or at least decrease in intensity when you stopped meditating. That's called de-challenge. Re-challenge is when it came back when you started meditating again. And that the same types of problems show up repeatedly within the same person every time they try to meditate. And that the same types of problems show up in the context of meditation across different individuals. And then we also have another criteria is previous reports, like other scientific reports. And so in the VCE paper, the scientific article that was published in PLOS One, we also reported 40 other scientific reports that have also reported similar types of issues. And then the last one is expert judgment. So in addition to interviewing meditators who had problems, we also asked meditation teachers, are these problems caused by meditation? And so they had to also be, teachers also had to say, yes, this is caused by meditation. So there's a lot there. It's very complicated, but I encourage readers, if they really want to see, to go either to that paper or to the Cheetah House website. And that's like one of the first questions under the frequently asked question, and you'll have more references than you ever wanted. So that's that question. The
Okay.
second question.
Sorry, I hit you with the double question. So
Yeah, I mean, that one, I get that one a lot, so I'm like usually ready for that one.
Okay.
The second question is, what types of experiences are people having? And again, in that particular article, we identified 59 categories of different experiences that were sort of categorized into higher order domains. So you see changes in, cognitive changes, like the amount of thoughts, like no thoughts or racing thoughts, the content of thoughts, delusions, hallucinations. So that's perception. So that was cognitive. There's perceptual changes in the way things appear or your senses. There's somatic and biological changes. There's affective or emotional changes. There's changes in sense of self, and social and occupational changes. Oh yeah, and then also motivational. So I'm trying to remember these off the top of my head, but I think I got all of them.
Okay.
And then in terms of, so I mean, if you really want the laundry list, you can go to the PLOS One website and download the code book, which is there. But I think instead of trying to sort of just overload people's with all 59 categories, I think what's more useful is to see which ones are probably most likely. And so we've been now looking at, mindfulness-based programs, like, very short, the 8-week MBSR, MBCT kind of programs, and trying to figure out what are the most likely of those 59 categories to show up in those kinds of contexts, because we do see things like mania and psychosis, but I don't think that most people need to worry about that. Those are for the average, meditator who's doing 30 minutes a day, that's probably not going to be what they're worried about. So the most common difficulties are all categorized as disorganized arousal. So signs of hyperarousal would be things like anxiety, panic, agitation, insomnia, loss of appetite, involuntary movements, traumatic memory re-experiencing, like flashbacks. And then, so that's hyperarousal. Oh, and then also just very, very labile emotions. Emotions are all up and down. And then, so that's hyperarousal. And then on the hypoarousal side of things, you see a variety of types of dissociation. So mind emptiness, feeling outside your body, feeling like you don't exist, loss of emotion, emotional blunting, things like that. So those are typically the ones that I think are going to show up in school-based programs, in apps, like kind of much more the much mindfulness light kind of programs, and the more severe ones I do think are more common in the retreat context.
Okay, yeah, so a few questions came up for me there, but I think the first one I would ask is, which styles of meditation are most likely to produce these, or have you seen a difference among different styles of meditation and the results? Because it seems, for example, if we were to broadly categorize meditation into, say, concentration-based meditation, where you're focused on, say, the breath or a mantra, and you're trying to really focus single-pointed focus, develop single-pointed focus, versus these open awareness practices where you're basically starting to really closely observe your mind and how it works, and you might just take the mind itself as your object of meditation. And then as a third category, we might say deconstructive practices, where you're essentially trying to go after your sense of self directly. A lot of these in a religious context or a Buddhist context, the tradition was trying to eliminate your ego, or kind of get you to realize that there's no real self there. It's kind of a construct, which according to this path would lead to, a state that's devoid of mental suffering. But obviously that can be very destabilizing. But so if we were to group meditation into these three categories of focused attention, open monitoring or open awareness, and more deconstructive practices, do you see differences among those groups in what kinds of symptoms people are reporting?
I mean, it's a great question. And again, I don't know if the methodology that we have is sufficient to answer it. But I can tell you that in the Varieties project, we saw predominantly people reporting both concentration and insight as what they had been practicing the most and what they were doing at the onset of difficulties. And the one that you forgot was Brahma Vihara, compassion, loving kindness,
Right.
kind of heart practices.
Constructive. Yeah.
And so we categorized those separately, and we didn't see a lot of loving kindness in our first study causing problems. And so for a while after that study, we had that data, I kind of went around saying that loving kindness and metta and compassion practices were safe. And then I talked to a couple teachers who specialize in those practices, and they were like, oh, we see our own set of problems. So Chris Germer has a whole program on self-compassion, and they have their own set of problems that come up with that. So
yeah.
I'm not.
I'm sorry.
Go ahead.
Sorry to interrupt. Yes, especially the Tong Lin practice of where you're kind of taking in the bad, or taking in the suffering of others, and then trying to put out the good. I was just on a retreat a couple of days ago, and some people were reporting really disturbing experiences with that one. So just to support what you were saying about the constructive practices that you might assume have emotionally positive benefits.
Right. And I think also, my sense of how common these experiences are and which problems are the most also is a consequence of who contacts me. And so I see a lot of people who are downloading an app that's telling them that the self is an illusion, and or even just hearing that on a retreat, or doing specific practices like who's looking, is there a doer, those kinds of questions. And I've seen a lot of people develop fairly persistent dissociation from those types of things. And so to me, because I specialize in that particular area. My husband and I teach a course at Brown called Me, Myself, and I, and we break down sense of self from multiple disciplines, including no self. So that's kind of what I feel competent in discussing with people and working with people. So from my perspective, that seems like one of the most common ones, but is it really? It's hard to say. Yeah. So I don't know. And I think the other sort of caveat, and of course I'm just going to be full of caveats because that's what scientists do, but is I think it really depends on the person, and I think it's hard to make any kind of generalization about who's at risk, which practices are the worst, anything like that. It's just, like I said, it's this combination. And for some people, loving kindness is going to be the best thing that ever happened to them. Actually, it was for me. That was really helpful for me. And for other people, it's going to destabilize them. And the same thing with concentration. So I think it really depends on what you're coming in with and what your individual, constitution is bringing to the table when you show up. And that can change too. So yeah, I think it depends.
And were the Eastern traditions at all familiar with these kind of side effects that might occur? Because it seems like in their context, they were really just focused on getting to this end goal of enlightenment. And maybe, if there's some side, if there's a few people that don't make it, then, it's kind of get there at all costs. But did they mention at all that there should be some sort of support or antidote to these issues that might come up?
Yep. So that is discussed in this paper and also in subsequent papers that we've written and are writing. But yeah, different traditions have a lot of different frameworks and differing and conflicting frameworks for working with challenges. So some traditions, like the Theravadan tradition, has a framework that's based on the 5th century text, the Path of Purification, the Visuddhimagga, where they have something called the Progress of Insight, which is delineates certain stages of awakening, and a lot of them have terrifying names, like knowledges of appearances as terror and like dissolution and things like that are kind of known to be difficult. So in that case, they're like, if you see some terror coming up in someone, then you're like, oh, they're in that stage and they need this kind of support. So it might signify something like that. Other traditions have, like, Zen has a term called Makyo, and Tibetan Buddhism has a term called Nyam, which can mean not necessarily like expected or desirable, but more like just nuisance side effects. And like, you're not supposed to it's not necessarily a sign of progress. It's just like, okay, just ignore that. And then there are other ones, in Zen, they have something called Zen sickness, which does actually require or may require certain kinds of, more medical interventions. And the same with Tibetan. There's a Tibetan term called Soklung, which is meditation can kind of stir up this wind element, which causes anxiety, basically, and sometimes psychosis. And in that case, if you have a wind disturbance, then it requires a medical intervention, which is often eating butter and heavy foods like meat or wine and beer and things like that. So there's a huge range. So on one hand, they're very well acknowledged, and there's no consensus for how to deal with them, even the same exact experience. So it's very context and culture tradition specific.
Yeah, and I imagine the context is also going to affect how someone interprets these things. So what might be called disassociation by by a Western psychologist, someone in the East might say, oh, good, you're making progress. That's an important insight that you had. You're closer to, the goal here. So how do you think about just, like, how should people think about handling these experiences that might come up along the path? Like, how should they be interpreting them within the framework they might have read about from their meditation teacher, or should they be more prone to a Western psychological approach, or what would you recommend?
Well, like, again, my general recommendation falls under the rubric of a person-centered approach, which is basically like, you can't make sweeping generalizations or recommendations because everybody is different and everyone has different values and goals. And so, I think the issue of, like, it's context specific, it's culturally specific, but which culture and context are you actually in when you begin a meditation app? Like, is your app, is it secular or is it Buddhist? It's like, it's not always clear. And I've definitely heard, people who went to the meditation app that was advertising benefits in a clearly secular way. It might even use the word secular and scientific, on their website. But then when somebody developed, like, called them in a panic, like, I don't feel like I exist, I don't have a body, then they were told, oh, you're having an insight into no self. And they're like, what? Like, I that's not what I signed up for. And so I think it's a really, really interesting issue of, like, informed consent, which is like, your advertising in some ways is a contract of which culture and which context you are promising. And if you haven't mentioned Buddhism or weird stuff that can happen or whatever on your website, then you've kind of committed to delivering and supporting, the health benefit angle, which is what you're advertising. So I think it's really, really tricky. And I see this sort of bait and switch thing happen a lot. And I think that's really unfair to the consumer. Like, that, if they wanted a religion, then they would sign up for one. And if they wanted something secular, then and that's what we promise them, then that's what we should stick to. So I think it's
Mm.
tricky, and I think it's really confusing right now. Like, I don't know.
Yeah.
A lot of these programs, like, they're sort of a mix, and
Mm.
it's not clear where they're coming from.
Right. Well, so I just,
One thing I will say is that with the people that call me, I see a fairly persistent sort of spiritualizing or dismissal of a lot of these experiences, where the person themselves are like, no, this is a problem. And then the teacher says, oh, no, it's a normal part of the stage of the path. And they're like, no, I can't work. Like, I don't feel anything for my children. Like, this is not okay. And so I think another question is, like, who should get to decide what's normal, what's valuable? I, I come down on the side of the meditator. Like, I'm sort of an advocate for, a patient advocate, and that they should get to decide what is desirable for them and not have someone else's worldview or values imposed on them. But it's a
right.
hugely complicated question, and a hard one.
Yeah, it seems like a real challenge. And I was just listening to a conversation where Daniel Ingram was speaking with, I think, Michael Taft. And they were talking about the importance of faith. Like, if you're going to really follow this meditation path all the way to the end, a certain part of you just has to trust that, hey, a ton of people have done this successfully. And there's going to be hard times. So, I mean, hard times come with meditation. So I guess what I would kind of I mean, I think one of the challenges that you've brought up here is that how much do you trust someone like the teacher or the tradition versus what you're feeling? Because oftentimes, you want to be able to have your own. It's kind of this balance that Michael and Daniel were talking about between, paying attention to your own kind of analytical mind and giving yourself power to know what's best for your mind, but then at the same time also having some degree of faith, if you want to call it that, or dedication to a tradition that really has kind of at least claimed to be a science of the mind in terms of just getting to a place where they're trying to eliminate mental suffering with, some kind of rocky paths along the road. So that seems like a fine line to walk, and especially a tricky situation given that we're still all kind of figuring this out. I mean, no one seems to have the perfect set of answers here. So I think that's partly why the work you're doing is so important.
Yeah, I mean, again, it's all of these questions are things that, we all as practitioners have to sort of answer for ourselves. Like, yeah, if you think meditation is going to be fun and peaceful and calm, then, like, you are extremely uninformed. Like, this is going to be hard, just like anything that produces benefit. Like, exercise is hard too. Like, anything that's going to bring benefit is going to have some challenge and difficulty with it. But I guess there, where's the line? And I think that line is a different place for different people. Like, if you're going to go through a period of difficulty, how long until you decide that it's not worth it anymore? Is it a week? Is it a month? Is it a year? Is it 10 years? Like, I think different people draw the line in different places. And I think, one of the things that I'm seeing happening, which is really interesting, is that because we know that difficulty is often part of the path, not always, but often, sometimes difficulty gets valorized as progress. And so then when people are actually showing signs of destabilization, they're interpreting it as progress. And so then they're like, oh, so I'm going to keep doing more of this thing that's destabilizing me. So I think that it can kind of flip where, like, non-progress gets flipped and interpreted as progress, or harm gets interpreted as benefit somehow. So I think we have to be also kind of careful not to do that, and to keep reminding ourselves, why we're doing this practice in the first place, which, again, that reason might differ between people too.
Right. Right. Yeah. So what a lot of the teachers that I really admire, or at least a few that I've heard that I really admire, are now talking about is this combination of Western therapy, having a therapist support you while also practicing meditation. And
Mm-hmm.
almost looking at those as two separate things, kind of growing up versus waking up is what Locke Kelly refers to it as,
Mm-hmm.
whose retreat I was just on. And he was having us do his meditation techniques throughout the retreat, but there was also a whole day devoted to psychological work in the system of interfamily systems. I think he calls it IFS.
Internal family
Internal
systems. Yep.
family systems.
Yep.
So he's really stressing the importance of combining both of these. And I know Shinzen Young has talked about also the importance of doing your psychological work. So what do you think about that as the future of kind of meditation training in the West, just that synthesis between Western psychology and kind of Eastern meditation practices?
I mean, I think it's, super important. How it gets operationalized and actually plays out, I think, is another question. I mean, I'm seeing a lot where the psychological or often trauma-informed therapy and the meditation instructions are coming into conflict. And so then what do you do? So it's like you're doing these two things. They're both been prescribed to you, but one is telling you to like go into the difficulty and like no pain, no gain. And the other is saying you should back off and not overwhelm yourself. And so I think another place of potential synthesis is this whole trauma-informed mindfulness movement, where it combines a lot of my research with knowledge that certain kinds of practices are kind of repeatedly causing problems for certain types of people, and to have those modifications on hand, or even do something different from the beginning. So I think that's also another way for this to play out. But I do think both pieces are super important.
Hmm. Do you think we will ever know, like, for example, if there's someone with trauma and they're getting told different things, do you think there's a way that's to study that scientifically, or are you studying scientifically, like what path should they take, or is it more of a very personal, person by person basis?
I mean, I think it's always a person by person basis, but I do think there are patterns that are showing up in the data. So, for example, David Treleaven, who's another person you should interview if you haven't already, who wrote the book Trauma Sensitive Mindfulness, he was, warning against any kind of body focus for people with trauma histories, because a lot of the trauma sort of like resides in the body and somatic ways, and it can be triggered through body focus. And we kind of tested that out in a study that I did, where we had people with and without trauma histories use different anchors. So we gave them 6 choices of anchor. So hands, feet, sound as non-breath anchors, and then 3 breath anchors: breath in the belly, breath in the chest, and then breath in the nose. And we did an 8-week program where that's all they did. And then at the end of 20 weeks, we asked them to choose a sort of favorite anchor and then a backup. And then at 20 weeks, we asked them which anchor did they prefer. And we actually found that half of the sample preferred a non-breath anchor. And then we asked people, well, why didn't you want the breath? And they said, oh, the breath actually made me really anxious or gave me panic attacks or something like that. And when we had the data on whether they had trauma or not, and we found that their choice of anchor, that their decision to choose something other than the breath was predicted by a trauma history. And it wasn't just the breath, it was the visceral breath. So the breath in the belly and the chest, which is, if you think about it, where all your emotions are. There's not a lot of emotions right here, and there's not emotions in your hands and feet. So, basically like attending away from emotion areas of the body is safer for people who have a lot of stored trauma in their emotional areas of their body. It sort of makes sense. So that's really easy. And actually, most of the mindfulness programs, MBSR has just written a new curriculum, and they just incorporated that whole finding, which isn't even published yet, into their curriculum. So now there's not, it used to be only breath awareness was offered, and now there's 6 anchors offered. So you start with them. And the reason for that is because if you've ever had a problem with the breath and you go to the teacher and they're like, oh, well, I guess you could like focus on a secondary anchor, like the feet. just like, you just get shamed into like, you're not a real meditator, like you didn't get the real object, but like there's at least 40 legitimate objects of meditation, so it's fine. So give people a choice at the beginning and have them find their own anchor that works for them, and then you don't have to shame anybody. So I think it can be done. Um, the research is starting to produce tangible empirical results, but it's early on in the phase.
Yeah, well, I mean, that's great that there's other methods and ways, and obviously there's so many different meditation techniques. I'm sure, or I'm hopeful that in the future, everyone will have kind of a path for them. If they're more trauma sensitive, they might not want to dive right into a open awareness practice, for example, where you're starting to make a lot of your unconscious or subconscious material more conscious, and you might just have some awful memories surface and uh, you know uh, uh, not really know what's going on there. So yeah, I'm glad that that's something that's already being incorporated into other programs. And so I wanted to, so I've already learned a few things because I have a meditation app called FitMind, and I want to make sure that I'm incorporating these recommendations into the program and giving disclaimers and offering resources. But what are some direct takeaways for maybe someone who's practicing, who's listening to this? Obviously, even though we've talked a lot of scary, we've kind of talked about a lot of potential side effects. I don't want to scare the listener into thinking they now just shouldn't meditate, but what would be some kind of maybe one or two action items where it's like, you should go do this right now if you're serious about your meditation practice?
I mean, I think one of the things that's missing from the kind of contemporary commodification of meditation and contemplative practices is the appreciation for how many practices there actually are. And so, for example, I mean, when I learned, mindfulness, it was like mindfulness of the breath, which we now know is like problematic for lots and lots of people. And what we actually recommend is an external focus, which for a lot of people was like, well, that's not really meditation, that's not real. But like, actually, there's lots of meditations, kasana practice, where there's like these big blue discs that are outside of yourself that you look at, are rampant in Buddhist practices. So I think that like we need to not just cherry pick from the Satipatthana Sutta, but like actually like look at all these different practices, and for people who are not particularly interested in being straight up following a specific Buddhist path, that they should have feel very uh, have permission to experiment with different ways of doing things, modifying practices, and really maybe before you even start a meditation app, like write down like what you're after, and what does well-being mean to you, what does it look like, and really like draw a picture for yourself, and then use the app for a set amount of time, again, however amount of time you think is a reasonable time to invest in something new. It could be a week, it could be a month, it could be a year, and then check back with your original intention to see whether that app is bringing you where you want to go. And if it's not, try another one. I mean, there's no there's no shortage of different options. And I think what happened, a pattern that I see over and over again for people who get into trouble, is they give away their authority to other people, to teachers, to traditions that tell them what well-being is, what it should be. They tell them what to value, how to be, and they sort of lose their internal compass. So I guess my first sort of meta comment was, you get to decide what well-being is for you, and don't compromise. Don't let anybody tell you what well-being is for you. And I think that's a pretty good safeguard to go into almost any practice with. If it's an app and there's no sort of teacher behind it, it's a slightly different thing than if there's a teacher in a community, where I think you have to really evaluate the person and how they are acting, and whether you want to be like them. The whole idea of evaluating a teacher is kind of like evaluating a potential marriage partner. But that's another thing. I think it's more about just keeping really knowing what it is that you value and not compromising.
Okay. Yeah, that's great advice. And thank you for making I was unaware of a lot of this before I'd read your studies, and the listeners aware of a lot of these potential pitfalls. So they'll at least know where to go to learn more if they're having trouble. And one other thing I'd add to, just from my previous conversation with Dr. Sarah Lazar, is that it's kind of the sports analogy she brought up, where especially if you have an injury, which in this case would be like a mental disorder or mental illness, then you definitely want to be careful when you're wading into meditation and some of the deep end practices, and maybe consult a professional before you do get into that, because it's not necessarily going to fix the problem, and it certainly could kind of exacerbate it. So for listeners, I've got your studies here. If they want to learn more, I think they can just kind of Google these or Google Scholar them. I have this feeling of not really being here, and the Varieties of Contemplative Experience, a mixed method study of meditation related challenges in Western Buddhists. Is there other places people can reach you, or like a website where you have those studies posted?
So if you go to my website, the Clinical and Affective Neuroscience Laboratory at Brown University, that's kind of my academic website, and it has a lot of my research papers on it. But really the one-stop shop for meditation-related difficulties is the Cheetah House website, which is cheetah, like the animal, house, like a house, 2h's.org, cheetahhouse.org. And that has everything that you need. It's got the list of symptoms with symptom-specific resources. It's got videos, podcasts, media, and also a list of different ways you can get help. So if you're in crisis, there's a way to get help with that. There's specific specialized therapists that you can, in your area, that you can link up with. So, and then tons and tons of research and information. So that's where I would go if you need help, or if a loved one needs help.
Nice. Yeah, I would imagine it's important to find a therapist who has some experience with meditation, or has some experience with that type of patient, because a normal therapist might not understand what practices you've done. So listen, thanks so much for your time. It's been great speaking with you. I've really, really enjoyed this conversation. And yeah, thank you for coming on the FitMind podcast.
Thanks for having me.